Hello friends, welcome back to my channel. I'm Sean, the Blessed Breast Cancer Guy, and I'm thankful to be here with you today. I wanted to discuss my recent bone scan with you, hot off the press. I told everyone at the beginning of this channel launch that I would share good news and I would share bad news, and no news is good news most of the time. But recently I went through a series of scans. Ever since I had my cervical surgery in May, my doctor noticed my blood work was getting a little, not looking quite right. And sure enough, we have some upticks in my cancer, my bone cancer. And it's actually amazing because, I've had pain every now and then here, pain here in the sternum area, pain in the rib cage, pain in the back area across my T8. I've always had SI joint pain for a number of years now. Since my fusion, it's been getting worse in 2017 from then on. So kind of a hot mess from a medical standpoint, but the enemy, good old Satan's not going to keep me down. So I want to review some things with you. I got my notes here from my recent bone scan, and I knew I had a CT scan done about a month ago. I was supposed to do a bone scan right after it, but laying flat on tables since my fusion surgery has really been painful for me. And I was joking with my nephew overseas, and I was laughing as I was telling him how much pain I'm in during this, and that's all I can do is laugh because, you really want to cry. I'll be honest, laying on that table is no fun, and I did spasm out twice on Wednesday. This is actually Friday the 13th, actually, September 13, in case someone's not following, 2024, and it's actually my late brother Gary's birthday today. So kind of a good day, but I have faith, so I don't internalize. I do miss my brother, but it's part of life. But being depressed is not going to bring him back. So, and I'm so thankful that he's no longer in pain, because I know he lived with a lot of pain as well. So basically, I'm just going to read through a little bit. I know some of it's going to be, weird, but I do want to share with anyone that possibly will have breast cancer and have it metastasized to the bones. And I'll tell you at the end what we're going to do about this. But for starters, when you get a bone scan, don't be fearful unless you got a bad back like me and you got to lay flat on a table. That's the worst part, is the laying flat. A bone scan is, even if you're claustrophobic, you can do this. So friends, don't ever sweat that part of it if you go in for a bone scan, because it's probably one of the easiest scans you're ever gonna have. They take you in, they inject you with some radiation, medicine, and then you leave for 3 hours or so, 2 to 3 hours, depending on the facility you're at, for it to get into your system. You go have lunch, you do whatever you have to do, you come back, you lay on the table, and it's about a 30-minute scan. I've had worse scans, so don't be fearful if you have to do this. But it says in the findings, it's a stable, mild focal uptake in the right side of the mandible, likely associated with periodontal disease or procedure. Redemonstration of diffuse increased tracer uptake along with the anterior aspect of the left first rib. Heterogeneous activity along the sternum with a tracer there, uptake involving the lower lumbar spine as well, which figured it was there too, the cancer. Superior sacrum and sacroiliac joints, which are slightly increased in intensity and extension in some areas. I'm only laughing because I knew something was wrong. You know, it's painful for me to walk long distances. Even though I have my balance back much better since my cervical surgery, I still need aid if I go, 50 yards I'm good, 100 yards I'm going to start feeling wear and tear and fatigue and stiffness. So, yeah, I keep my cane in the car, and if I go anywhere long, I will grab my walker. I'm not too prideful for that, but in and out of stores, in and out of the gym, in and out of church, I'm really focusing on walking and strengthening myself up because I'm too stubborn, too stupid to give up, I guess. But let me read this here a little bit. Okay. Mild, stable, diffuse tracer uptake along the posterior left ninth rib cage associated with the lateral-posterior focus of activity that correlates with diffuse sclerosis or focal fracture, respectively, on the CT. New foci of increased tracer uptake in the right posterior aspect of T8, and which I'm thankful, because I either thought I fractured my T8, which is like the brawl line of, if you think of the middle of your back, that's your T8, that's your spine T8 area, and which I fractured that in 2020 when I was diagnosed with COVID and cancer, all within 3 weeks, and a T8 fracture. There's also an aspect left on my T11 and T12, so I got a tumor in that area as well. Associated with coscondylar junction of the foci and see as seen on the CT scan. Couple things they're thinking from healing fractures that I've had in my back, that's showing a little bit of that. Mild degenerative changes in the shoulders, wrist, hips, right knee, ankles, and right midfoot. It had some pain in my right foot, and I was wondering what was causing that. So I don't know if that means the cancer's there or if it's just aging. You know, as we age, we pick up a lot of things that degeneratively go away and age on us. So, and then so they're saying that interval mixed changes with overall progression of disease characterized by a slightly more avid and extensive foci of sclerosis involving the right first rib, sacrum, lower lumbar, and some in the pelvic area of the bone area. Lesions, bone lesions on CT suggesting metastatic disease, which we already knew that. Relatively stable, mild, diffuse tracer uptake along the posterior left ninth rib, also likely metastatic. With this adjacent focus of increased uptake likely associated with pathologic fracture. New foci of increased tracer uptake along with right, second, and seventh junctions, as well as 3 posterior foci near the conjugal junctions of the mid and lower thoracic spine, may be associated with post-traumatic healing fractures and or skeletal metastasis. So it could be from breaking my back a couple times to just the cancer. Attention on follow-up recommended. That's about it. You know, it's all technical jargon, but I want to share if you can see something here. This was down in 2022. I was in the normal range. Normal, this is your cutoff for normal. If you see this right here, I'm trying to show you. So I was normal. Okay, somewhat normal, we'll call it, but no, I was normal, joking. And then we increased, and that's when we found the bone cancer. And then we started treating it, and we got it to drop it through treatments clear down to here. If you see here, and this would have been in April of this year. If you notice, if you remember, in May of this year is when I had my cervical spine surgery. and I had to go off my meds for 4 weeks, 5 weeks, longer than what we wanted to. And my doctor, my oncologist, thinks that's when we lost control of it, and it started to increase on us, as you see here. Well, I asked her, I said, that looks bad, that's a big increase. If you look here, this is 10, 20, 30, 40. 40 is like 38 is your normal, or under is where you want these lines. I'm up now to 80 is the top line here, if you can see. So I'm up high, you would think high, right? And I asked her about it, and my oncologist, and she said, she has people in the thousands. I'm not even 100 yet, but she wants to get it under control. So that's why I laugh, I joke, she could have told me I was going to die tomorrow and I'd just go on about my day. That's just how much faith I have in God, and he's my ultimate doctor. So although I have a really good oncologist, she's glass half full type oncologist, we're going to change up my meds. I will be dropping my Ibrance. I have carpal tunnel surgery coming up 1st of October. I've only been dealing with it since 9/11/2001 was when I was first diagnosed with it, as I was watching the towers and all that sad, tragic stuff happen up in the northeast of our country with, as we all know. So I've been dealing with this for 23 years, and now it's severe enough, and now that I'm on my laptop more as I'm doing this channel, I'm teaching English as a second language. I'll post some pictures of my class. I volunteer to do that. I give back to the Latin community that lives around me, and part of a nice program that their kids can go to, and I really enjoy giving back. And then I'm working sermons when I'm doing my preaching when I'm asked to do that. So I need to get this fixed now, because I'm going to do the right one and then I'll do the left. But after, I'll stop my meds just before. Again, this is just a quick outpatient, hour, 2 hours, and I'll be back home. No big deal. When you've been cut open as much as me, I think they could chop my head off right now and I'd tell you that it's no big deal. But no, this is seriously, it's been ongoing, and carpal tunnel surgeries have come so far that the healing's 4 to 6 weeks, but I'll be back in the gym as soon as I can bandage it up and get it sweaty. I'm not taking much time off. But she's going to put me on a different medicine, and it just so happens this particular medicine that I'll go on has the properties to tackle the actual type of cancer that's within my bones. So she said, I'm very fortunate, and I say I'm blessed, but God's watching over me, that this medicine will attack right at that bone area, and it should prevent this from growing anymore. So, and we knew this last year. We knew this was going to be a lifetime of chasing this cancer and dealing with it with meds, treating it with meds. And I'm so thankful that I don't have to do a traditional chemotherapy. I can keep my life going. Minimal side effects on the meds. The 21-day Ibrance, you feel like as it's lowering your white blood counts, you get fatigued and tired, and more of the sniffles and things. You're more accessible to catching a cold from someone, but I don't isolate myself. I got to live my life, and I'm going through these medicines and the monthly IV treatment and the shots in the rear end to have a life. And if I can't live my life, why go through the treatments? Just let cancer take its course and go home to God and be at peace, right? But no, he's got me for a purpose, so we're not going to give up. As my shirt says, we're not giving up, and we're going to continue battling this. And but I feel like I'm in good shape. I feel good. I left the oncology, and my appointment, and I went to the gym and did my bike and did a little bit, and go back tomorrow. I have a leadership training seminar tomorrow that I'll be attending, and then I'll hit the gym and come home and watch football. So I'm gonna live my life, and as anyone should. Mark chapter 9:23 of the Bible says, if you can, and everything is possible for the one who believes. And I just read that earlier, and I thought, that's pretty good. I want to jot that down because my memory's not great. And everything's possible for the one who believes. And I truly believe that. I'm in a good frame of mind. I'll be putting out another video on how God prepares us for these things from 1997 I'll go back to current, and how everything happens, and there's a process, and there's processes right now I see that's taking place that God's calling me for, and I need to buck up and face it. And it's not even about me, it's about helping others. So there we have it. We're not going to give up. Don't ever give up on your end. Whatever you're going through, put all your faith in God, because He's our ultimate healer. He's keeping so many people alive with cancer now and with bad diseases. And although we don't feel the greatest at times, we're still here. And as we're aging, you don't feel better. You don't feel good as you age normally. Things start to hurt more and break down more, and that's the aging process. So I just wanted to share this with you. To God be the glory. This is not the best report, but it's also not the worst report, So we're there. There you go. I appreciate you, friends. I appreciate all the prayers. And until next time, thank you for viewing this. Please hit like on this, even though it's not a likable video because of the news, but it does help if you do like it for me. Just trying to get it up there when someone looks for this type of stuff. So appreciate you all, and once again, to God be the glory. Always keep the faith and never give up. Breast cancer guy, blessed breast cancer guy, Sean here, and I thank you again. Love you all. Appreciate the prayers.